Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana at Prather Chiropractic Services. Today we have a gentleman from Anacoco, Louisiana, Mr. Tracy Manning, who found us on YouTube, right? Is that, you've seen some of the videos. And he came in, he's had chiropractic treatment before, he was experiencing some long-standing lower back pain that radiates across his belt, goes down the leg to the knee. He feels out of kilter. He feels like when he stands in a neutral stance, he's always leaning to the right. Nobody ever told him really what was going on. So he came to us, wanted to see if we could help him. We did his x-ray examination and we found some interesting findings. So, I can turn your attention to this x-ray, Megan. What we've seen here and discovered is that Mr. Tracy has something called an anatomic leg length deficiency or an anatomic leg length difference. Now this can get a little bit complicated and I don't want to be too long-winded here, but what we've discovered is that the bones on his left side are collectively a different length than the bones that make up his leg on the right side, this predominantly being the femur and the tibia. So we do measurements and those measurements give us information about the imbalance. And we can see he has somewhere around a 12 millimeter difference from one side to the other. Now, that is an anatomic leg length deficiency. To repeat, is when you have the bones on one side of the leg, tibia and femur collectively, are physically a different length than the bones on the other. Now, this can be worsened by the alignment of the sacroiliac joints. This is the sacrum, this is the ilium. Together they make the sacroiliac joints. The alignment of the sacroiliac joint can either worsen or correct an anatomic leg length deficiency. When that's the case, we call it a functional leg length deficiency. In Mr. Tracy's case, the alignment of his pelvis has actually worsened the anatomic difference. So what we can do chiropractically is correct the alignment and the motion of his sacroiliac joints and improve the existing anatomic leg length difference and relieve some of that compressive stress and pain that you're getting from it. Now, keep in mind, chiropractic works on not so much the static alignment, but the functional motion of the joint. We want to improve the movement of these SI joints and release the pressure that's trapped in there. You've been walking around for 48 years, cockeyed, right? With what? Well, maybe not 48, that's your age. So since you've been full grown vertically, since this took place. And when we look at the lateral x-ray, this is the lateral lumbar, here's your sacrum here, profile. What we see is that your L5 disc and your L4 disc has degenerated prematurely because the weight being distributed through that joint is uneven. Just like we talked about a tire on a vehicle. If that tire's out of balance, the tread is going to wear off prematurely. You use your body. So we move and we move under gravity. So like we were talking about that orthopedic component to what we do, there's a neurological component to what we do too. But in your case, you have a lot of degeneration in the joint itself because of that long-standing wear and tear. Just the foundation is off, so the tree tends to lean that way, and your weight distribution has been uneven since then. Does that make sense?
Yep.
Okay, so the adjustments we're gonna do today is going to relieve some pressure that's trapped in those joints, and that's gonna relieve some pain as a result too, okay? I'm pretty confident we're gonna be able to get you feeling better before you walk out of here, okay? Do you have any questions about that before we get started? Okay?
No, just as long as it alleviates some of the pain,
All right.
I'll be happy.
We're gonna give it our best ride, okay? We're gonna start out on this biophysics table, and we're gonna adjust on the X and the Z axis, and then we're gonna finish up adjusting on the Y axis with the famous ring dinger adjustment that you've probably been studying.
I've seen it.
All right. Okay, sir. Let's go ahead and get you face down, right here, face on the paper. Okay. Now, what we've seen on the x-ray is a short right leg. Now, what you see in real time, in real life, is a short right leg. Bend this knee, bend the knees for me. See, he's short and he stays short, okay? So, how much that's going to change with just working on the pelvis, hard to say, but we're going to get some movement in there anyway. Okay, Tracy, I want you to just let your body sink into the table, okay? everything nice and comfortable. You're gonna feel that pelvis piece start to kick up here. Start mobilizing these SI joints, okay?
Okay.
Good. So we're adjusting him PIEX on the right side. Now adjust it ASIN on the left. Now we're pushing that L5 and L4 forward on the x-axis. Okay, very good. Now, let me see. So he's still a little short, as I expected, but it got better, okay? It definitely improved about a centimeter or so. All right, we're getting some good release. Now, Tracy's had compressive stress all the way through the thoracic spine because of that uneven foundation. Everything that stacks on top of that foundation is subject to some uneven wear and tear. That's just logic. Okay, sir, let's have you go ahead and roll over onto your back for me. How you feel?
That L4 and L5, I felt that.
Yeah. Okay, we're going to be working on that head forward. We were talking about
Yes,
flying in the. Tracy also works in Brazil, so he's got long flights, long times on airplanes, being bunched up in the seat, and it puts a lot of strain on his upper back, his neck, etc. So we're going to work on helping him with that too. I want you to take your arms, open them up, feel the chest piece kick up. Tighten it up a little bit here. There we go, sir. All right, hands on the tummy. Now, we're gonna let this leg dangle. See if we can't pull that right leg longer, huh?
Okay.
Be a neat trick. Very good. Where you felt that?
I felt that.
All right, good. Same thing here. Okay, didn't need to pull that one as hard. Okay, come on up for me.
Yes, sir.
Spin you this way. Okay. Loosen up these joints. Let your shoulders dangle. Ooh, that was a good one.
Yeah.
Let that elbow relax. Okay, good. Remember you said how everything felt off on your right side?
Yes,
That's
sir.
why you're getting those big movements, big cavitations. You've gotten more pressure trapped in the joints on the right side. Okay, there we go. Where your head. You ever been adjusted like this?
Never.
Okay. Just making sure. All right, my man. So far, so good?
Yeah.
All right, getting a lot of good movement. Okay. So now we're going to go get the y-axis done. Follow me. All right, Trish, we're going to have you seat right here and then lay down with your head this way. There we go. All right, man. You lined up pretty good there. Hands on the tummy. Now we're going to elevate the legs, put the spine in neutral. Just keep those legs nice and relaxed.
Okay.
The table senses you moving, it'll shut off. Safety mechanism. Get you a little bit higher. Oh, it felt you move. It's tough. It's like your instinct is kind of wiggle a little bit, huh?
Table's smarter than I am.
tight squeeze, my man. Just let the pin sink. There you go, nice and tight. Okay, good deal. Okay, for this we keep the back teeth touching. Tongue in the center of the palate. Good contact with the towel. Breathing through the nose. And wiggle your third ear. Don't forget to breathe. Don't forget to breathe. Let it settle in.
I'd never felt anything like that before.
How far down did you feel it go?
To my soul. I literally felt it all the way into the lower part of my back.
Yeah.
But it was really
Yeah.
up top, but I felt it all the way down.
Through. Yeah. Gravity's been doing this to you for 48 years. So we just released a lot of that in one blow. Now, remember I talked about you're going to get more out of the inversion table that you've instinctively been using? That's why. We've been able to unjam those joints, unlock that fixation. So when you go and do a sustained stretch, you're going to get more translation of those joints on the y-axis, and you're just going to get better results with it, okay? Because they're locked. You remember you said you always feel like you're on the verge of something releasing.
Right.
So it's going to get even better. All right, good. You got your breath back?
I do.
Yeah. Okay, good. There's nothing left. Very little left. Let that head go there. That's it. Good, man. Timing is a big part of getting a good quality adjustment. The chiropractor needs to really feel when the patient gives it to them. That's how you avoid getting hurt in a lot of cases. Okay. There we go. Hop down, walk that around. Give me a before and after.
I feel a lot looser.
Good.
I mean, I really do.
Okay. What about the pain along the belt line?
It's
What about the knee?
no pain in the knee at all.
Okay.
I mean, I don't even feel that.
That crepitus,
Movement.
that
Yeah.
clicking.
I don't feel that.
Okay.
And when I walked in earlier, every step I took,
Yeah. You can feel something.
I'm sure no one else could hear it, but I can hear it in my
Yeah,
in my
exactly.
body.
And that is called crepitus, and that's a classic sign of joints tracking wrong, like we talked about. Now for you, being that there is that true anatomic leg length difference, and because you work away for so long, we will talk about maybe putting a wedge in that shoe to shim up that right side. That's what chiropractors have done for decades. When you find it and diagnose it correctly, that's one of the most easiest things we can do to help level you off, especially when you know you're going to be on your feet working, etc. So I'm glad you're feeling better.
I do. I feel 100% better.
That's awesome. Well, thanks for letting us record the experience. You had a really interesting case that hopefully some people can learn something from. If you like this material, if you think we can help you or somebody you know, please share it with them. Hit the bell for notifications, subscribe to our channel, and we're here to help people with safe, natural chiropractic care. Any more questions for me, Trace?
No questions
You're
whatsoever.
Good to go. Here's your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.